Good morning, School District of Indian River County. This is your Superintendent, Dr. Moore, here with a Facebook Live update. Specifically today, talking about the protocols and mitigation strategies that are in place around the spread of COVID-19 in our schools. Last Tuesday evening, our school board approved an item to require face masks in schools pre-K through 8 with the opportunity to opt out with a doctor's note. This is a change in practice from where we started the school year. As you know, we started the school year with a high recommendation of wearing a face covering while indoors when social distancing was not possible. For those families who chose to opt out of following that recommendation, you were provided the opportunity to send in a letter or go into Focus and log on, making it simple as possible for you as a parent. As we evaluated the first 11 days of school, we quickly came to the understanding if we did not shift or change practice based on the relevant data, we were quickly approaching the space in which and the date in which schools would close. Total school closure, grade level closure, as well as classroom closure. We looked and made a recommendation to the board to be approved based on the data, based on the reality of where the school district of Indian River County is, based on a decision that every single child deserves a free and appropriate public education, and that it is our primary responsibility to guide and lead a district in order to ensure every child who wakes up goes to a school and it is open, it is safe, and children can engage with the great instructors that are in our schools and receive a quality education to maximize their full potential. As I go through this information, let me be clear, let me be transparent. This is not a decision that I wanted to make. For those who know me personally, who have reached out and said, man, it must really be bad for you to make this recommendation. Because I know who you are and I know how you believe, and I know it must really be bad in Indian River County for you to recommend a decision like this. And that is the truth. We cannot have our head in the sand. We must look at the reality of what's taking place here, and we must respond. So today we're going to look at a few different areas: level of community transmission, student COVID-19 positivity rates, staff COVID-19 positive rates, availability of human capital for coverage, health and safety considerations. So when we look at this particular information, you can see as a community, we all know this, the community transmission is at a rate of high. We have 273 students who are out on quarantine. That's about 1.8% of our student body. That number continues to grow, and it continues to push beyond what other districts are doing, and we'll look at that in a minute. We have 108 staff members out. We're at 5% of our staff out. That is a concern. That is a major concern. As a result of that high number of staff being out, we have deployed district staff, which is the available of human capital for coverage. We have about 50% of our available district staff in schools covering classrooms. We're still holding true that quality instruction needs to be taking place each and every single day, and we will work with our schools as needed in order to ensure that that support is being provided. And when you send your son or daughter to school, there is a qualified instructor standing in front of them, providing meaningful instruction to them. I want to look at some of the level of community transmission. This is information provided from the CDC tracker. It is updated each day. It compares over a 7-day total, looking at weeks. So you can see in terms of total number of cases, there was a 16% increase from the previous week. Percent positivity was 27, which is an increase of 0.17, so we're seeing it leveling off there, so that is encouraging. We see a decrease in hospitals, which is 98, a decrease of 15%. That is also encouraging, yet percent of beds being used is an increase, 42%, and then ICU beds currently being used in Indian River County is 62% basically, which is also a decrease of about 3.5%. So some of this data is encouraging, some of it is not. Here is a look at our new dashboard. And as we have learned, COVID-19 is fluid. And as we learn through this new reality, which is each and every single day, we need to have the ability to respond. So some of the information that you'll see here, we've made some modifications, one of which is the home test. And I've had the opportunity over the last several days to speak publicly about the impact of home test. Families are going to CVS, you can purchase the home test, and you can take it at home, you have that information. When we started school for the first week and a half, we had about 8 home tests, and now over the last week, we've had about 75. So the number has continued to grow as access to those tests becomes more and more available, and families are aware of them. We think it's responsible of us, A, to let families know when a home test is being presented to us as a school system, we need to let those who were in close contact with that individual know. The health department does not conduct quarantines on home tests, but we think we need to let those families know. So if you or your child was in close contact with an individual who reported positive from a home test, we will inform you so you can make the decision that you feel is right to monitor for symptoms, to send your son or daughter to school, quarantine, and we will provide that work for you. We also have added what we are entitling no school impact. These are cases identified through the health department that did not result in any quarantining or impact to the school. Typically, we would see these numbers on a Monday or a Tuesday when a student had symptoms over the weekend or Monday morning. They go back 48 hours and they look to say, is there an impact on the school? Do we need to go through the contact tracing process? And if the answer was no, there was no impact to the school. We want to give a whole picture as to what's going on. Typically, you won't see these numbers grow unless it's a Monday or a Tuesday. Some things I'd want to point out. On this dashboard, this is live, 44 student cases yesterday. That is an all-time high for us as a school system. We've never had 44 positives in one particular day. So on 8/24, we had the all-time high for staff, which was 24. And then yesterday, 8/25, we had the all-time high for students. Now, let's look and do a quick comparison to where we were this year versus last year. So on August 25th, which is 12 days of school, you see we have 273 cases. How long did it take us to get to 273 cases last year? It took us 6 months. 270 cases over the course of 6 months, 12 days, 273. That says this is serious. On that same day, February 10th, 6 months into the school year, we had 128 cases. 12 days into this school year, 108. So you can see this is significantly different than last year. This is significantly worse than last year. This spreads at a significantly higher rate than what we were doing or what we were exposed to last school year. This looks at a number of areas or schools in our district where we had high concern. This is an opportunity for us to look at how we maintain the operation of schools. So as an example, Beachland, Citrus, Treasure Coast, Vero Beach Elementary, you can see those are outbreaks. The number of students, the number of staff, and then the low percent of students coming to school as a result. Families making a decision to say, I'm going to keep my child home, they are healthy, they are safe, but based on the current mitigation strategies that are in place, I don't feel comfortable. We don't want that decision to be made. We want every family to know, even in the midst of this pandemic, the school system is taking every step based on the reality of where that county currently is. Our county, Indian River County, is making those strategies and implementing them in a way in which they are safe and secure. So this is part of the information that we want to offset. Now let's look at us in comparison to our partners on the Treasure Coast. If you look at Indian River County, you can see 1.8% of our student positivity rate. In comparison to both St. Lucie and Martin County, we're about 1% higher. That's not what we want to see. When you look at the percent of staff that is positive, we're significantly higher than those two counties. We're almost at 5%. So there is work that we need to do. What is happening here needs to shift and change as we right this ship as it relates to our mitigation strategies with COVID. As a result, we are implementing a 2-week face covering requirement in our pre-K through 8th grade spaces. This is an opportunity to wear masks or face coverings when social distancing is not possible indoors. Once again, let me say it again. It's not the requirement that was in place last year. It's specific to being indoors on school transportation when social distancing is not possible, a face covering. That is what we are asking for going into next school week. The recommendation that was approved was to implement beginning Monday and then evaluate it over the course of the next 2 weeks and bring additional recommendations, modifications, or changes based on that 2 weeks of implementation. I also think it's key to include, as of last Monday, we asked all of our faculty and staff to wear masks using that same criteria when indoors when social distancing is not possible. So that is in fact for all the adults that are in our buildings. It has now been aligned with our children. There are opportunities for an exemption. That is a medical exemption that you can receive from a medical provider, a Florida licensed physical doctor, a physical assistant, psychologist, or psychiatrist. Please take the opportunity to make those appointments in order to secure those notes. This is a different opt-out from what we started the school year with. Initially, you were opting out from the face covering. This is a new requirement. So if there's an opportunity for you to secure that note from your doctor, it is a simple note. You have the doctor, the psychologist, the psychiatrist write it, bring it to the school, and we will enter it and make sure everyone is informed. If you had one of those exemptions last year, we are going to honor that exemption so there's no additional work on you. We will enter it so your student can continue to be exempt from this new initiative moving forward. If there is an IEP or 504 accommodation that needs to be made, please reach out to your school and we will quickly review that information and have that entered. Those are the exemptions that were approved. Religious exemptions were discussed during the board meeting, not included in this particular item, but there is policy and procedure in place if that is a requirement for you. If you can't get your appointment, we want to work with families. So if you have an appointment that goes into next week, please write a note, let us know that you're pending that appointment so we can honor that time leading into that particular appointment. This is the protocol practice that is in place for the school system. Won't necessarily review this in great detail, but we are following the state's recommendation regarding quarantining. I will tell you this, the health department, our pediatricians, the entire health system in Indian River County is overwhelmed. When you're working this many cases in a particular day, it becomes very bogged down and slows the entire process down. The slowing down of the process makes things worse. So we are continuing to work with our health department to initiate these proactive steps to help mitigate the spread of COVID-19 in our schools, but it is a slower process than I would like. Instructional support while at home. If you're choosing to stay home because of a quarantine, or you're going to self-isolate your child because of what you see in our schools, we're available to have this resource provided to you. 5 days of lessons are always going to be on Canvas. Continue to reach out to your teachers who can provide that support to you if that need be the case. If you're not finding that support, we have instructional advocates for each and every single school. This is a proactive approach where these individuals will be reaching out to you and available for you to reach out to them as well. So if you're going through these home assignments and need additional support, we want to offer that to you, and they will also be reaching out to those who have been quarantined to say, is there additional support that's being needed? Frustration around support as a result of a quarantine or self-isolation, don't allow yourself to feel that frustration. Please reach out to us, let us support. We understand it is our responsibility. We understand that this is hard and complex times, but we want to be here to support. So please, this information is on our website. These are the individuals that you could call. On our website, we have our assistant superintendent's number. If you're not finding those supports effective or being done with fidelity, please reach out to us. Here is the Office of Advocacy and Information, Student Affairs, Advocacy and Access, if there's any additional support that you need. These are very, very difficult, hard, and complex times. We're moving into a reality that is challenging. We as a community need to stick together in order to move through this time. This is a decision that wasn't taken lightly. This is a decision that may not be popular across the entire community. But based on the reality of where we stand, it would be disrespectful, it would be defiant for us not to examine that reality and then respond. We're asking for the entire community's support in implementing this initiative. Because we want to? Absolutely not. Because the data says the school system that educates the children in Indian River County is on the verge of closing. We do not want to have that happen. We saw and experienced the impacts of closing doors last year. We saw the ineffective practice of virtual models that didn't fully address the needs of children. At the beginning of this school year, or preparation for the beginning of this school year, the energy and excitement was high because we were going to get back to what we thought was going to be normal. Unfortunately, right now, that is not the case. I want to continue to thank all of our educators and all of our parents for working with us in this difficult time. The stress level is high. Our principals, this is just one more thing for them to take on. And they have been true champions, true leaders in the midst of the last 12 days of schools, and I know they will continue to do so. Our teachers bend over backwards to have the accommodations and provide the encouragement and support for our students. I know our students look forward each and every single day to see their teachers. And we want to keep that going. We do not want this to be a long-term solution. We want this to be a short-term strategy that rights the ship. That's why this plan wasn't 90 days like other districts did. It allows us the opportunity each and every 10 days to evaluate where we are to make those changes. So we're looking forward to continuing to provide the highest level of support that we can. We're looking forward to leading this district with a great deal of integrity, a great deal of respect for what's happening in our schools, and being responsive to meeting the needs of each and every single child in our school system. If there's any additional questions or concerns, please feel to reach out to our advocacy office. We're here to support and we're here to help. Thank you and have a great day.